Figueras. You are the director and co-founder of the European Observatory on Health Systems and Policies. Thank you so much for taking some time to answer some of our questions as part of the Young Gasteiners program. So our first question is, already acute before the COVID pandemic, health workforce shortages are more stark than ever, as highlighted in the reports that you were leading on by the WHO on health and care workforce in Europe. Time to act. While the case for investment is clear and accumulated evidence highlights the return on investment in investing in the health workforce, governments are already considering budget cuts for human resources for health to tackle the growing economic crisis. Now, how can we make the case with ministers for finance and other financiers for increasing investments in the workforce? What are the immediate solutions, but what are also the long-term advocacy focuses that we need to adopt?
Thank you. Well, first, I hope you're wrong, and I hope that the Minister of Finance indeed are not cutting the health workforce budget, because it would be a suicidal approach, as we are right now. We have serious problems with access as things are. We have a burnout workforce. Should we cut them further, we'll get a negative cycle and a serious problem, a rigorous problem with access to health services. Listen, access to health services now is an issue of sustainability, of security, of political stability. If we have a winter of discontent with waiting lists and people not be able to access to their primary healthcare doctor or the hospitals, we will see lots of political discontent, and for the politicians and policymakers this is less votes. And actually there's a relationship between health status, reduced access, and radical voting in the polls. So, and populist voting in the polls. The second argument to Minister of Finance is that no access, more sickness and less productivity. And we see the case with the long COVID. The long COVID is going to be affecting our labor markets. Third point, health is an important area of employment. In many countries counts as one of the highest employment sectors. So invest on training, invest on this, on all these health and social health care workers and social care workers to actually get the economy going. As to what we can do, there are many measures there, and we were talking yesterday, as you know, in the full session, so it would be difficult to summarize them now. Certainly is the area of attractiveness. And attractiveness is not only payment, it is working conditions and flexibility. We have a new workforce that wants much more flexibility, part-time and so on, feminization and so on, older workforce. So flexibility is extremely important. We need as well, we were talking about that yesterday, to make it sustainable, to work on different skill mix. There's many allied professionals that could play a bigger role in supporting the doctors, or rather than supporting the doctors, working side by the doctors. And then I think one of the more difficult areas is the area of aligning with education. Aligning because we keep training a workforce that is not the workforce that we need. So we need to work together with the health service, the education and the finance sectors. That to me would be three of the key strategies, as well, of course, as I said, attractiveness, and try to bring more professionals, the young professionals like yourselves, into the healthcare profession.
Thank you.
So, Dr. Josep Figueras, thank you very much for sharing your previous here and for taking that into consideration the paramount importance of the health workforce in our healthcare systems. As you are already aware, primary care settings have been under a lot of pressure, unprecedented pressure during the pandemic, and the health workforce practices and responsibilities had to reorganize in order to face such as unexpected challenges. And in this direction, what are the elements and conditions for capacity building in primary care that would strengthen their overall robustness to unpredictable events, and the capacity to ensure access to care and treatment continuity?
Good. Well, first, you're right. The research we've been doing in the observatory shows that those countries with a strong primary health care have been much more effective in dealing with the pandemic. There's a bit of a misunderstanding in that some countries have been arguing that it's the number of beds that's made a difference. It's not true. Number of beds has been important, of course, but it's been as important the ability of primary health care to monitor the cases of COVID, to do a key role in the screening, in education, and so on, and testing. So a good part of success has been thanks to primary health care. That's the first point. The second, clearly, we were talking earlier about the crisis in the health workforce. If the crisis is more acute, it's really acute, it's precisely in primary health care, in rural areas. GPs, family doctors we have a real crisis of vocation, so we do have a crisis in nursing working in primary health care. What can we do about that? We said earlier in the earlier question about the attractiveness and flexibility. Well, we talked about all these elements, payment, working conditions, but the flexibility in primary health care is particularly important. We used to have these GPs, I was a GP by the way many years ago, that would provide continuity of care, would work 24 hours literally to see their patients. Our new population, it was discussed beautifully yesterday, our new doctors and nurses are not prepared to work 24 hours every day being on duty for continuity of care. They want better working conditions, want part-time work, flexibility, and we need to adapt primary health care to their needs. Otherwise, they just will not join the profession. Of course, it goes against some of the principles of continuity, but we need to be pragmatic and make it realistically attractive to that constituent, to the primary care doctors and nurses. The second is giving them a bit more also support, e-health, more specifically telemedicine, more specifically accessing directly the diagnostic tests that are done in hospital, accessing directly specialist support would make their job more effective for the system and more attractive for themselves. Third, we mentioned the skill mix. It is in primary care, integrated care, where we need to work the hardest. And we do have the evidence. We just published some work on patient navigators. Would be a nurse or another professional that works side by the primary healthcare team, supporting the patients to access services at secondary level, tertiary level, or integrated care, social service, and so on. Nurse practitioners can resolve more effectively than the doctor a lot of prevention and chronic care, lots of prescription for chronic care follow-up, or primary prevention, as well as could be leaders, from the nursing side, or the social work side, could link to primary care the whole of integrated care. So that's another element. And the final element is what we've been discussing since Almata, which is primary care and public health. In some countries, we're talking about Slovenia these days, my own country, Spain, really primary care and health care is linked to public health. So there's a good access to surveillance, to information, to screening, to information systems, and public health and primary care work side by side. So if we have to talk about more effectiveness, is more linked to public health, but also continued training our primary health care providers in public health issues.
In this regard, I mean, as a pharmacist by training, how could pharmacists be more integrated in this initiative, in your point of view?
I would be a bully with the pharmacists. I think if pharmacists in pharmacies do not play a role in chronic prescribing, in advising patients on their treatments, some do, some don't. I would put pharmacists in supermarkets, would be cheaper, okay? Pharmacists are very well trained, are very well prepared. During the crisis, we saw them playing a key role, as I said, in chronic care prescription, in advising. They took it over. In some countries, such as the UK, for instance, many primary care centers have pharmacists working in the primary care center and being the ones prescribing and controlling chronic care, like diabetes, hypertension, and others. So the role of pharmacists is fundamental as part of that primary care team. But I do not see, in many instances, these pharmacists being integrated there. I think we have to push the profession to understand that, and we have to push the system as well to integrate them more effectively.
Excellent. So thank you very much for this valuable intervention by your part. So Josephine, I don't know if you want to express something.
Just thanks as well. It's
Yes.
been very valuable.
My pleasure.
Thank you so much for your
Thank
time.
you so much.
Good luck.